Hi, this is Bedrest Coach Darline Turner, owner and founder of Mamas on Bedrest and Beyond. And it is the day after, folks. Okay, I will admit I am really excited that President Obama was reelected. And some of you may cut this video off at this point right now, and you are entitled to your opinion, and that's okay. I think for me, the biggest joy or happiness or the thing I'm most excited about with the ongoing of his presidency or the continuance of his pregnancy is that the Affordable Care Act will stand. The new healthcare reform act law is so controversial and so many people have so many feelings about it, and I understand that. But as a healthcare practitioner, as a healthcare consultant, and as someone who advocates for people, I can't not tell you how excited I am that it's in. I am one of those people who thought, yeah, I think we should go for a single payer system. I think we should do away with insurance companies. So I'm probably pissing off a whole bunch of folks right now. But I just think that in a country as rich as America, everyone should have health care because the health and wealth of a country is only as good as the health of its constituents. And if we're not a healthy people, we cannot create a healthy country. I work with high-risk pregnant women and a few babies. Pretty much once they start having the babies, we move out of the picture. But it is so critical that women have good prenatal health care, good well woman care, good preconception care. And for so many women, millions of women, this was not the case. And it's going to show up. I think it shows up in our society where we have babies with issues, where we have lots of preterm births, where we have just issues with healthcare. And I think if we did more to support moms and babies and families, that maybe, and this is, me talking, I think we would reduce a lot of the issues that we're seeing. Um, the Affordable Care Act is not perfect, not by any stretch of the imagination. It's got some issues and some things that are going to have to be worked out over the years. But it's a start. It's somewhere we can start and something we can look at and go, okay, we're going to keep this part, we're going to ditch that part, we're going to, restructure this part over here. But at this point, I just want to highlight what is in the Affordable Care Act for women right here, right now, and why I am so thrilled that this has been enacted. General well woman care. I mean, we talk so much about prevention, and yet there are millions of women who, prior to this act being signed, had no access to affordable health care. So they were not getting their annual pap smears and pelvic exams. They did not have access to contraception. And as a result, they suffered for it. Many women had abnormal pap smears. Some of them had human papillomavirus. They then developed cervical cancer. And, we can go on and extrapolate on. But the bottom line is when people do not have access to affordable, accessible health care, they develop health conditions that they are not caught early. They spiral out of control, and by the time they are detected, they are sometimes lethal, which is often the case, not often, but sometimes the case with cervical cancer. When a woman can have annual paps and pelvic exams, that can be circumvented. The abnormal cells can be detected, and treatment can be initiated early, quite frankly, saving her life. There's been a lot in the news about funding for Planned Parenthood, and so many people are against funding for Planned Parenthood because they believe that they only do abortions. Planned Parenthood, about 5% of their business is abortions. All the rest is well woman care. And I do know that at some, not all, and I can't say which states, which centers, they do some well child care, early on. If you do not have anywhere else to go, and I say this personally because when I was first out of college, I had moved to California and I had gone to a Planned Parenthood for a pap and pelvic exam because I was 21, 22, no longer on my parents' health care, and I hadn't gotten a job yet, needed to have a pap and pelvic, there was nowhere else for me to go. And I went, and I think it was all of $25, took care of myself. Life is grand. Once I got a job, I had private insurance and moved on. But there is that time period, which the Affordable Care Act now does cover, between college and sometimes stable employment for people, which, is between about 21 and 25, where a lot of people are unemployed. Now, I mean, not unemployed, uninsured. Now, granted, in that age group, major illnesses are often rare, but this is also a group that may be skiing, snowboarding, cycling. Not so much that these are risky activities, but activities where injuries, major, big injuries can happen. And if you have to pay for them out of pocket, I mean, even if you get an ACL tear in your knee, that's surgery. Hopefully laparoscopic, but even still, it's surgery. So you have hospital fees, you have surgeon fees, you have anesthesia fees, thousands of dollars for one surgery. If you're 24, 25, you can't afford that. This is what's great about this. But let's get back to well woman care, and in particular, why I like this law for high-risk pregnant women. In addition to well woman care, where she can go in and get her pap, pelvic, sexually transmitted infection screening for human papillomavirus, the virus that causes genital warts and cervical cancer, HIV testing and counseling. She can get contraception without copay. Yay, this is a really good thing. She can do preconception care. She can get ready to have a healthy pregnancy. Hugely important. When she is pregnant, there is screening for gestational diabetes. It's covered. This is huge because if a mom develops gestational diabetes during her pregnant, her health as well as the health of her baby is at risk. A lot of these babies grow to be large and they come early. So it looks weird. You think, oh, well, they're big babies, they're healthy, but a lot of their organs and things have not fully developed, especially the lungs, and this can be an issue. So it's great. They're doing screening for gestational diabetes, and we can ward that off and treat appropriately. The Affordable Care Act covers breastfeeding support, breastfeeding supplies, and breastfeeding counseling. I don't even know if insurance companies typically cover breastfeeding support. So this is huge. If we can get more women breastfeeding who want to breastfeed and give them the support and the education and the encouragement, maybe we'll start seeing women going more towards that recommendation of the American Academy of Pediatrics of 6 to 12 months, preferably the 12-month mark for breastfeeding. There is newborn and well child care up to age 21. So again, if you don't have, a job that has really good insurance, your child is still going to get their well child checks. They're still going to get their immunizations. They're still going to get care. We talked about the care for students up to age 20-25. And this is one that's huge for mamas on bed rest. And it's a mixed bag. On the one hand, women at bed rest are at increased risk of preterm labor and preterm birth. We have a lot of preemies. Depending on the age of your child at birth, your child can have some significant developmental problems and need extra care. Now, for some people, just the very stay in the neonatal intensive care unit can practically bankrupt the family. I mean, if you have a child at, say, let's say 24, 26 weeks, they will be in the hospital anywhere from 14 to 16 weeks. NICUs run at the minimum $1,000 a day. I mean, we're talking a lot of money here, people. Lots and lots of money. Families that just spiral into financial ruin over this. And that's not even, we're just talking $1,000 a day to have a little bed there. We're not talking about any monitoring, any nursing care, any antibiotics, any medications, x-rays, blood work. I mean, we're not even getting to all of that. So, I mean, it is a huge cost and a huge potential burden for families. Additionally, many of these children, when they are born so young, have developmental problems later. They may have a heart defect, or They may have breathing problems. They may need glasses. Some of them will have cerebral palsy. If they have any type of intracranial bleed, they'll have problems with that. I mean, the list goes on and on. But with the Affordable Care Act, these children cannot be denied insurance. And this was what was happening. You know, parents would have a child with these special needs and then couldn't afford to get them the care that they needed. And it was a real struggle because as a parent, we all want what's best for our babies. You know, even if our babies are 6 foot or whatever, we want what's best for our babies. We want the best care. And it is heartbreaking if you feel like you can't get your child the best. Now with the Affordable Care Act, children who have pre-existing medical conditions, because if they come early, they have issues, it's pre-existing, they are covered and their care will be covered and they will get the care that they need. Now, I'm sure there's a lot more. I kind of did a cursory review, particularly for high-risk pregnant women and what's coming along. But, you know, before you throw out everything and like, oh, this really sucks and I didn't want Obama and I don't like this, you know, insurance plan or whatever, go to healthcare.gov and let me check and make sure that's the right name. Yep, go to healthcare.gov and actually see what the law says. You know, they have it up there. You can read it. It's long, there's a lot to it, but you can kind of pick through and read the sections that are pertinent to you, but really see what the law has to say and see what it covers. Again, it's not perfect. It's not optimum. You know, everybody will find something wrong with it, but it's a good start. It'll give us a framework or you know, foundation to kind of build on. And in the meantime, millions of people who didn't have health care now have health care, and more specifically to my heart, moms and babies. So here we are, the day after. Whew, Lord only knows what's going to be coming these next 4 years. We'll all be here. We'll be living it. We'll be experiencing it. And it'll be a wild ride, but you know, it's a good thing. And we are so lucky to live in a country where we can, I mean, I'm sitting here talking about this on a video. In so many countries, I might get my head blown off for doing this. So we are lucky that we can, you know, state our views, share our ideas and opinions. And I'm really proud and I'm thankful. And I'm glad to share this information with you. And as I hear more and learn more, especially as it pertains to Mamas on Bedrest, you know I will be bringing it to you. So that's it. I'm Darline Turner, Bedrest Coach, owner and founder of Mamas on Bedrest and Beyond. Thank you so much.